Hola. Stuck on the couch today. I have a buddy. And I've been working on this blanket. I've been crocheting. It's not done yet. It's still got the little phrase. But I'm frustrated from dealing with constant pain every day. And I know that a lot of people in our community deal with chronic pain also. And I know sometimes it's really hard to find answers, and I'm still trying to find answers. But I'm frustrated, and the pain is keeping me from work. So I figured I might as well share about it. Like, the only thing I can do today is lay down because I'm in too much pain when I sit up straight. I have a doctor's appointment tomorrow. So here's this guy again. I wish he was in the shot with me. But I wanted to share it. So I was going to title this like my endometriosis journey. But here's the thing. And I know so many of you women know this. You can't confirm endometriosis unless you go inside your body with a laparoscopy, which is so infuriating because the only way to confirm you have it is to have a surgery. And that's so intense. That's so intense, and that's such an expensive way to find out if you're dealing with something. So I'm going to share what I've been dealing with for years. Like, I'm sitting here thinking, I can't remember my life before this pain. And I hate it. I even think there's so many layers of pain that they've just become normal. Like, I've normalized the pain and I just live with it. And I'm not saying this to like get sympathy or anything. It's just like, I don't recognize my life anymore. There's heating pads everywhere. I use ice packs. It's ibuprofen. It's like foam rollers. There's like a protocol I have to go through before I can sit in my chair and get any work done. So I want to share some of what I've experienced. I've talked with some people in our community about this too, who have been very helpful about helping me like kind of make some progress or get some momentum or whatever. So I'm thinking currently where I'm at in my journey that I'm dealing with endometriosis and also possibly Ehlers-Danlos. And oftentimes I have learned that the two of those things can go hand in hand. They're both autoimmune or autoimmune adjacent. Like, there's connections there. So, hi, Helen. Hi, Jazz. Okay, so specifically, I can remember back as far as like, at this point, let's see, it was pre-pandemic, right? There's so many things like, was this before or after pandemic? So this had to be like 2019. Okay, so that would have been 6 years ago. And I remember at this point, I had already been dealing with this pain, but it had gotten to a point where like I wanted to do something about it. So 6 years ago, I reached out to a physical therapist friend and I say, hey, I've got this really intense pain in my right hip flexor. And I had been researching the muscles, like, is this the iliacus? Is it yada, yada? I don't know. It's a pinpointed, like, intense kind of searing pain that flares up when I do a workout. And it feels awful. And it's like I have to take a couple of days off after I do a workout. I mean, it's like a good workout, but I'm not doing anything insane. Like, I'm not lifting a ton of weight or anything, just trying to get my heart rate up and lift moderate weights. Okay. So I remember reaching out to her and she gave me stretches, and I'm going to tell you, I've done all the stretches. I've done all the stretches for hip pain. I know all of them. I can teach them to you. I do all of them all the time. And now I'm realizing like maybe I've done too many stretches, because if Ehlers-Danlos is at play, then maybe I've overstretched and maybe that has exacerbated the whole problem. So I remember that 6 years ago. That's after it had gotten bad enough that I reached out to a friend because it was persistent pain that I didn't know how to get a handle on. And that would continue basically, like, I feel like it never really went away. And another like really specific part of the pain is it's like a pinching on the top of my right thigh. So, like, if I pull my knee toward my chest, it's like this pinching pain. It feels like everything's being squeezed, and it's almost like a nerve pain. Oh, Amanda, I'm glad to hear that you had a successful surgery and didn't. That's so amazing. So I'm dealing with this pain. I would ice it. I would, take a few days off of working out. And for context, like, my body's always been super, super sensitive. Um, I've had to cut certain things out of my diet. I've been gluten-free for like 8 or 9 years now. Yeah, Sue 2. I don't know what your name is, Sue-11. Yeah, pelvic pain, but hip pain, hip flexor pain, front of the thigh pain, and it's grown to go like up the right side just underneath my diaphragm and my rib cage, and then it wraps around into my lower back. So my lower back hurts me all the time. It's like there's pain everywhere all the time. And it's just kind of spread into this web of pain. So it started with the hip flexor pain. I thought it was the iliacus. I thought I was overstretching or doing too much intense workout. Like, I have a history of being a dancer. I was on a kick line when I was in high school. I did the P90X workout when I was younger, back in my young days, like, I guess in my 20s. And when I did P90X, I broke a bone in my foot. So I highly recommend not doing plyometrics, which is jump training. I broke a bone in my foot, which again is just like, I'm very sensitive and things are affected easily with me. Like, it doesn't take a whole lot to make my body mad. And I've always been that way. My mom's always been that way. She's always told me, like, we're delicate, and we are. Like, I say that, but I also feel like, I know I'm biased and I can only live my experience, but I also feel like I'm one of the toughest people that I know. Like, I can take so much pain. Which is why I'm making this video. Like, enough is enough. Like, I have tolerated so much pain. I don't know what the heck is going on, although I think it's endo. Okay, so I deal with this with the stretches that my PT friend gave me. The pain sticks around. It like lets up a little bit. It'll come back. It's something that I was like, okay, it's always there. And like, maybe I tore a muscle and it's like taking a really long time to heal or something. Yeah, Jas, the endometrial tissue can show up anywhere in your body. Like, my PT was telling me that they have found it in the brain. And recently, I did not confirm this, but my physical therapist said, do your own research, that they found endometrial tissue in a man, and someone who is a male. So there's so much that we don't know about endometrial tissue. Okay, so fast forward to about a year ago. So I still have this pain flare up. I'm used to it. It's just like part of my, oh yeah, my right hip, like, it's always bothering me. But about a year ago, the pain started becoming daily and intense daily, to where like I had to the point where I look up and I'm like, I don't really recognize my life, because I've modified my exercise, I've modified my physical activities, I've modified how I interact with my kids, I've modified, my self-care routines so much. Like, I feel like so much of my day is just managing my pain. It's just pain management. So much of my time goes to managing my pain, where I'm like missing out on so much work that I want to do. I can't sit at my desk for like very long. Which is why I'm here on the couch. And if you're just joining us, look who's also on the couch with me. Oh, he's stretching. Yeah. Oh, yeah. Okay, buddy. Such a sweet boy. Oh, he's so happy. So let me tell you about the things that I've gone through this past year to try to diagnose endo. So first of all, I started with an ultrasound. I said, I think I've got a hernia. Like, something is happening in the right side of my pelvis, and It feels like a pressure. It feels like a bulging sensation. It's kind of a shape-shifting thing. Like, I don't know. I think there's a hernia. So I had an ultrasound, and the sonogram tech, they're not supposed to tell you things, but she was like, "This is a hernia." She's like, I've seen bigger ones, but like this is a hernia." So like, "Oh my gosh." So they give the results to my surgeon, and the surgeon says, "No, this isn't a hernia." So I had thought that there was some kind of answer there. No. Um, so I've had um, pelvic ultrasound. I think I've had 2 of those. We redid it after the surgeon was like, "No, there's not a hernia." I was like, "Please, like, there's something there, like, please, can we redo it?" The tech thought they saw it, and they're like, "No, it's just I totally disagree, that's not a hernia." So I was like, "Oh." So we redid it, nothing there. Um, in the meantime, I'm having this history of recurrent UTIs, but there's not necessarily an infection that's showing up. It's just like the cultures are not showing an infection, but the other markers are showing UTI. Um, so I'm dealing with that, and they're not like typical UTI symptoms. It wasn't like burning and stinging with urination. It was like, and I know this is a lot of information, but like I feel like I need people to know, because if it will help give you answers, it is so worth it. Okay. And I love the body. I love health. I love learning about these things. So like maybe it's too much to share. I don't think so. I want to be helpful and to share my journey. So I probably had like 3 or 4 different UTIs over the course of 4 or 5 months, and one of them put me in the emergency room. So again, I feel like I'm pretty tough. I feel like I can tolerate a lot of pain. In January of this year, I woke up in the middle of the night and I was like, something is terribly wrong. And let's see, I didn't have my kids. I think they were with their dad. And I waited until like 6 or 7 in the morning, and I texted my mom. I was like, "I need to go to the emergency room, or I need to go to urgent care." The pain was so intense that I was almost shaking. I was almost crying, like could barely walk without just being in excruciating pain, and it felt like something was about to rupture. So I go to urgent care. I remember almost passing out in the bathroom. Like I got up and I felt lightheaded. I was like about to pass out from the pain. Finally, the nurse takes me back and I'm like sobbing. I do not recognize myself. I've never done anything like this before. I've never responded this way to pain before. I'm sobbing. I'm like, I am in so much pain. I'm in so much pain. Um, and so let's see, what did they do? They did a urine test, and then they sent me to the emergency room for blood work, because they're like, we can't do it with the blood work here at the urgent care. So I had to go to a different facility. It's like racking up the medical bills. So they said, well, you've got a raging UTI. Well, it didn't feel like a UTI. It was like lower back pain, and it felt like my appendix was going to burst. And I've had UTIs before. This did not feel like a UTI. And this is the one where I feel like the culture that came back didn't show an infection, but all of the other markers were really high. And this is a frustrating experience because, in particular, this urgent care center, they did not hold on. They did not send it out to culture it for the infection. That's right, because I called them back and they're like, no, we forgot to do that. I mean, they didn't admit that, but they're like, no, that wasn't ever ordered, and it's too late to do it now. So the jury is out on whether or not there was an actual infection there, but this did not feel like any UTI I had. So I was like, I feel like something inside of me is about to rupture. So they send me to the ER, but everybody's like very chill and just like, it's a really bad UTI. Like, we'll put you on antibiotics. So I go to the ER. They do all this blood work. I had a comprehensive metabolic panel. I can't remember the other panel I had. They give me a CT scan. I had one with and without contrast. So to this day, and I'm jumping ahead, I've had like 12 different scans in terms of ultrasounds, CT scans, MRIs. I think I'm up to 12 now. My appendix has not been visualized on any of these scans. Nobody has seen my appendix, and I've never had it removed, so it's there somewhere. So I'm in the ER. They do the blood work. Everything's great. My blood work's always great. The CT scan was great, but it showed bilateral cysts on my ovaries, which they're like, those are probably benign. Like, it's probably nothing to worry about. Nothing else showed up as an issue. I went home. The pain got so intense, and this is where I really actually feel like something bursts, and I think maybe it was a cyst. I don't know. Nobody was ever able to give me closure. I was shaking, like convulsing in pain. It was the worst pain I've ever experienced outside of childbirth. And my mom's like calling the ER doctor, and he's like super chill. He's just like, I don't know what to like tell you. Like, you can come back in, but I don't even know what we would do for you. Like, and I'm trying to like get words out, and I can't speak. I'm trying to like explain to the doctor what's happening. So I'm in my bed, like freaking out because the pain is so intense, and I was like having to do like Lamaze breathing to calm myself down because it was so intense. So to this day, I'm not sure what happened. I think it was an ovarian cyst that ruptured, but I don't know. So they put me on some antibiotics. It took about probably 10 to 14 days before I like felt okay again. During this time, let's see, I think I had another ultrasound at some point. So I've had different pelvic ultrasounds, abdominal ultrasounds, vaginal ultrasounds, CT scan with and without contrast of the pelvic, of the abdomen, and then I've had MRIs. Like, there's been so much. So I've had pelvic MRIs, abdominal MRIs, and then because I was still convinced it was a hernia because of like this, oh, I'm reading some of these comments. Yeah, I know. It was like they didn't take my pain seriously, and I know everybody likes to think they have a high pain tolerance, but like I have to get massage therapy regularly because my body hurts so bad all the time. And I've talked to multiple massage therapists, and they're like, "Are you sure you're okay?" Like, I'm just like, "Please, like, go deeper into my tissue." I like need like really intense pressure, and I can handle a lot. I guess my proprioception is just different. Okay. So I'm convinced that there's some type of hernia situation going because it feels better when I get a compression sleeve. So I've been wearing compression sleeve around my stomach, and there were just certain sensations that would happen where I'm like, there's something in there that's like popping in and out. So I hire a hernia specialist in California who takes women's pain seriously. And she's very big on like listening to the whole story. Here, do we need a bell tray check-in? Oh, he's my buddy. Are you gonna stretch again? Oh. Can you hear him purring? I didn't ask him if I could film him. I'm sorry, buddy. You making biscuits? Are you too tired? Okay. He's so sweet. Okay. Okay, so I hired the hernia specialist. She is in California, and her name's Dr. Shirin Tofig. For anybody that's interested, and her mission is to educate women about pelvic health, and a lot of times how hernias go undiagnosed because they look different in women. They can be smaller but still cause a significant amount of pain. A lot of male doctors don't know what to look for, like how to navigate internally to find these hernias. And so she did like an extensive detailing of all of my imaging. So she looked at all the CT scans, MRIs, blah, blah, blah. And I felt like if there's anybody who could for sure rule out hernia, it would be her. So at first she came back, she said, you have 3 hernias. There's an umbilical hernia, a left inguinal hernia, a right inguinal hernia, and possibly another one. So let's do another MRI scan. And she has like this specific protocol for MRIs that she does where you can image different things at different angles, and it helps particularly women find hidden hernias. They're called occult hernias. Wait, is that? Oh, hello. Yeah. Hi, Nikki. Hi, Life with Rachel. Hi, Kalina. Hi, oh, hi, girl. Okay, so I do an MRI. Basically, this is all done over email, like my interactions with her, because I'm basically paying her for her expertise from California, because I'm not going to Beverly Hills to go get this done. But it still was like a financial investment to have her expertise. So I get this MRI done here the way that she prescribed it, and I did it all at Touchstone Imaging, which there's several locations in the DFW area. I was gonna recommend them, but actually I don't. They've really mishandled a lot of my information, so I can't recommend them. Um, like, every time I need them to send my results somewhere, they always botch it, and they have added months to me getting diagnosed. Um, so anyways, I don't like to single people out, but I don't know why I brought them up. I guess there's some anger there. Um, so the MRI comes back and she says definitively, she's like, okay, there is a left hernia, but it's very small. The likelihood of it bothering you ever is like slim to none. And there's no sense in getting surgery because it's not like a medically, um, it's not like a medical risk for you to have this hernia and just leave it alone. So she's like, I wouldn't do anything. And she's like, doesn't look like there's anything else going on. But in some of the MRIs, they came back with labral tears in my hip. So these are like hip socket tears. They're bilateral, so one in each hip, or I don't know, there might be more. What else did they find? So there's labral tears, bilateral cysts on my ovaries, which they said could probably be benign. My appendix has not been visualized in any scan, but I think it's also a retrocecal appendix. I think that's the word, where it's like retroverted. And my uterus is also retroverted. So like sharing these things again, because autistic people often have so many differences, especially with connective tissues, and connective tissues are at play a lot in issues that we experience. So again, I want to be an open book because it's so hard to find answers. So I'm telling you what I've learned. Okay, so then they're like, well, let's start with physical therapy. Oh, no, 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 sorry. Oh my gosh, I forgot such a huge part, because for the past year, this is what I have been doing, is like managing my pain and trying to figure it out. Okay, so my primary care physician sends me to the OB-GYN, because I told her, I said, get this, guys, get this, everyone, get this. My mom, my grandmother, and my great-grandmother all had endometriosis and hysterectomies. My mom, I think, had her hysterectomy when she was 33 or 34. I'm 36. My mom and I are so similar. So I go to the OB-GYN, and it was like a very brief appointment. And I tell her what's going on. I tell her all the pain I've been in, and I tell her I've ruled out so many other things. And I told her, I was like, I just want somebody to go inside and like figure out what's happening. At this point, I've done blood tests, I've done imaging tests, I've done, I've seen so many different doctors and all that. Like, somebody please go in and just see what's happening inside. She's like, well, I really want you to do, well, hang on, I'm skipping ahead. So I will tell you, like, my cycles are pretty normal. So that kind of led her to dismiss me as an endometriosis candidate. I don't really have intense pain, but also this is one of those things where I used to, like, I almost missed a friend's wedding because my period pain was so bad. And somehow that has gotten better over the years. I don't know if it was, I had kids and things changed and like, but my cycles are pretty manageable, nothing really out of the ordinary. And I told this OB, I was like, my mom, my grandmother, and my great-grandmother all have endo, and they all have had hysterectomies. Well, I'm just not really seeing any, like, I don't think you would be a good candidate for a laparoscopy to go in and see. She said, before we would even do that, I would really want you to go on birth control for 3 months to see if we can like isolate the pain and see if this is what's causing it. Well, I have a history of alopecia, literally have worn wigs before because I've lost like half of my hair. Like, just big, huge, gaping bald spots everywhere. I used to wear wigs, and my hair still, like, even after my divorce, my hair started falling out again because it tends to flare up in like stressful times. And I told her, I said, I can't go back on birth control because it messes with my hormones and then my hair falls out. And I just think, especially autistic people, we just do not, and this is a generalization, but we just don't really do well when we modify. I personally, like, you have to make the decision for yourself, obviously, but like modifying your hormones is such a big deal. And for some people, that's necessary and helpful. But for me, it is a train wreck. Like, it completely just F's with me. So I said, I'm not open to doing that. And she basically was like, well, this is the end of the road with me, with me working with her. Because she's like, if you're not going to do birth control, she's like, I don't really want to She actually had a conversation with my general surgeon who said that there wasn't a hernia on the MRI. And she's like, maybe we could do a laparoscopy together. And that way, if there was a hernia or endo, we could both like be there. And they had a conversation about it and they both disagreed that it was a good idea. Neither one of them felt comfortable going that route. So it was like, so great spending all that money with you. There's other stuff. Okay, I'll share this part too. So I had an abnormal pap during this time too, and thought I had cancer. And I don't. But that was like this huge waiting process too of like abnormal pap. Okay, now I have to go to a specialist to have, oh gosh, I forget what the term is called. Somebody in the comments will know. There's a special like procedure you have to go in and get done to have cells tested. I can't remember the name. Somebody's going to say. It is very expensive, Ashley Jen. It is very expensive. And I'm at the point now where I'm like, I guess, like, I'm at the point now where I'm like, numbers don't matter because I just have to feel better. I mean, obviously they do matter, but I can't look at the number signs anymore because I just have to feel better because it's just affecting my life so much. So I thought I had like cervical cancer, but I did not. But that was another stressor in the middle of all of this. And everything's good there now. So anyway, the OB-GYN was a dead end. My primary care physician says, well, no, it wasn't even that. One of my friends, actually, that I met through the channel, she was like, why don't you do some craniosacral therapy? She's like, your nervous system is shot. You are so, yes, it was a colposcopy. Thank you. Thank you, nurse. It was a colposcopy, which is not comfortable. And oh my gosh, when I had the colposcopy, it was the day before I went to the emergency room with whatever happened. So I was in an extreme amount of pain, and I told them that I was in an extreme amount of pain. And like nothing was done other than like, oh, I'm sorry that you're in pain. Like that night was when I woke up in the middle of the night and was like, something inside of me is about to explode. So this year has been so awful, you guys. And I don't like saying stuff like that because it's like I'm kind of, what you focus on, you create more of. And I try to like focus on the positive things. There's been a lot of really beautiful positive things in my life this year too, but it has been such a hard year. So my friend says, do craniosacral therapy. Your nerves are shot. Your nervous system is overwhelmed. It can be so helpful and healing for you. And speaking of helpful and healing, let's check in with the kitty. Oh, yeah, you're a good boy. Oh, this blanket's a work in progress. It's a wedding gift for a friend next week. So we're breaking it in. I was crocheting and Beltray was right here. And he like kind of put a paw down and he was like, I need to lay on that blanket. So we paused the crocheting. So I find a craniosacral therapist who actually is close to my house. And I start going to him. He's very expensive. Of course, doesn't take my insurance. So with him, I've done craniosacral therapy. I've done, dry needling? Yeah. Done dry needling, which is a very weird experience. I've started pelvic floor therapy with him. He's done visceral manipulation. And what he's found there is that my psoas is really tight. So your psoas is kind of like a survival muscle. It's like your fight or flight muscle. So it makes sense. I've been through a whole lot the past few years. So my psoas has been really out of whack and that's really tight. And then also my colon and my cecum, I can't even remember what the cecum is. I think it's part of the colon, that those feel kind of like tight, which I'm now, like I'm jumping around, but I'm now thinking there could be some adhesions there. So he's been trying to like break up some of that tension in my colon. And then So I think my uterus had some kind of like, so with visceral manipulation, it's like with his hands, with his fingers, he's kind of like feeling around different tendons and ligaments and kind of making sure everything is adjusted and um, functioning the way that it's supposed to. So I've done all these different modalities with him, and the pain has like changed shape a little bit, but it hasn't gone away. And the confusing thing is I haven't really been able to tie the pain. I haven't really been able to find a pattern with the pain in my cycle, which I'll be honest, I haven't been able to like intentionally track it. I'm thinking that if I did, here's what I think I would find. I don't know if there was any hypertonicity in my colon. I don't know if he's commented on that. But there's so much information that I've been trying to keep track of. Where was I going with that? Tried different modalities with him. Oh, the pain's been like changing shape. I'm trying to find patterns. I think the pattern I would find is that every other month the pain flares up more than usual, because I think it's to do with my right ovary, which is where I've always had pain, even especially when I was younger and I had like really debilitating cycles. It was on my right side, and it was always my right leg. So like the pain would shoot down my leg, and it would like keep me from going to school and stuff. And I don't know why that got better. So I'm thinking that there could be a correlation there every other month with the right ovary when the pain spikes. But so I've been doing physical therapy, very expensive physical therapy, that I think has helped make the pain more manageable, but hasn't necessarily solved anything. So yeah, the gut brain axis, and I know that, and I cut out alcohol. I've cut out things that are inflammatory. I need to cut down on sugar, but at this point I'm trying to cut out anything that's going to cause inflammation or pain, because I have to feel better. So I definitely understand. I know the gut brain axis is huge, and I know if I cut out more inflammatory foods that I would feel better. But I just realistically, as a single mom, I can't eat as cleanly as I would like to, just because it takes so much foresight and planning that I don't have right now. Yeah, Lisa J, I have heard that cis can feel like you're in labor, which is why I feel like that's probably what happened in January. Even though I never really got any confirmation or anybody to like give me the time of day, like a medical provider. Okay, so I guess on my last cycle, it did kind of flare up, and I called my mom at like 10:30 at night. And I was like, Mom, I was like, I have to get rid of this pain. You know, I was like in tears. I was like, I have, like, I can't keep living like this. And she was like, okay. She's like, we're gonna figure it out. And so, and I mean, she's helped me through all of this, but like the next day she was texting me. She had been researching endometriosis centers in Dallas. And I was really overwhelmed by this whole process, because I was like, nobody's gonna take my insurance. And I'm so tired of advocating for myself at this point. And like, I just go into an appointment thinking that I'm not going to be believed, you know? Like, oh, you just pulled a muscle or what, I don't know. And so she sent me, the first link that she sent me was for pelvic rehabilitation center in Dallas. And I remember I was sat down at my desk a couple weeks ago, and I was like, okay, my goal today is to find somebody who will see me for endometriosis. And that was the first call I made, and they accept my insurance. And I was just like, oh, thank you so much. So I scheduled an appointment with them, and I had my appointment last week, and they took me seriously. They said that I was a really good candidate for endometriosis like treatment. that I had a good case for endometriosis and that it very likely is what is going on. And they recommended, they have like a whole protocol for women for endometriosis, and it's a series of injections. It's an injection that's part steroid, part lidocaine, and they alternate hips. So like 1 week it's the right, well, it's not really the hip, it's like this sensitive area. um, but like they switch sides. The next week it's your left. So you do that for 7 weeks, and it's supposed to decrease the pain and inflammation. But obviously that's not going to make the endometriosis go away. So I told her, I was like, that sounds great for pain management, but somebody needs to go inside and just make it go away. She's like, okay, you can meet with our surgeon. So tomorrow I have an appointment with the surgeon. And from what I can understand, this is not me proving that I need to have the surgery. This is, we're here for you. We will do the laparoscopy. No. Okay, let's get this guy out of the chat. Okay. So I'm not going to have to prove my case. The surgeon's just going to basically talk with me about what to expect moving forward, and they're very thorough in their approach. So like they don't just look around the reproductive organs. They basically go from I can't remember, like I think they go from like rectum to diaphragm. So they cover like a very wide area looking for endometriosis, which is really important. And they also do excision rather than ablation. So excision is getting it out of your body, and ablation is just kind of like burning it off, but it doesn't like get rid of it fully. So I got the injection done last week, which is really intense. So they get this spray that like basically freezes your skin, like, and they keep spraying, and it's like, they said it was going to feel really intense like needles. I honestly, it didn't bother me. Like the spray didn't bother me. I was glad I didn't look at the needle. I let my mom come in there with me, and she said the needle was like 6 inches long. So I'm glad I didn't see that. And so the next day I woke up and I thought, I actually like my right hip actually feels better. And I was like kind of taking guys, I was kind of like taking a deep breath, like, okay, there's some relief there. And I'm making my bed, and I grab a pillow to put on my bed, and as I twist to put it on my bed, I pulled a muscle in my back so hard. Like, I cannot remember pulling a muscle this badly before, and that's why I'm on the couch right now. So this is a week ago. I can lay down, but I cannot sit up. So if y'all saw me in connection groups yesterday, I had a ball that was like acting as a pressure point on the back of my spine to try and direct my attention away from the pain in my lower back. So I don't know what it was. I don't know if like, and here's something interesting that has been coming up like in physical therapy and other, I don't know, just in other ways. It seems like my left side is more inflamed than my right side, which is crazy because my right side hurts and my left side doesn't. It's so weird. And I don't know if I've just numbed out. Seriously, I have gotten so much better at mindfulness and meditation because of my pain. So I guess I'm grateful for that. Like I just breathe through it. I try to be like the observer of my pain, right? The observer of the pain. Like, what quality does this pain have to it? And can I breathe into that area? And like, how does the sensation like change shape and sensation? And so like I've been able to approach it in different ways mindfully, and I feel like maybe there is pain on my left side that I kind of just numbed out. So anyways, when they did the hip injections last week, I'm wondering if that side finally kind of let go and the other side was like overcompensating. So my whole left side feels like jacked up, and I have been doing ibuprofen, heating pad, ice. Let's check in with the kitty. Oh, he's stretching his toes. Hi, buddy. What you doing? So I don't know if the injection and pulling my back are related, but I feel like an old person. I'm 36, but I feel like so old because I can't sit in a chair. But, oh, okay. So the other part of this is last week at the Pelvic Rehabilitation Center in Dallas, who I highly recommend at this point in the journey. I'm very new to working with them, but they took me seriously. Before I even said anything about this, the woman that I saw, Maisha Banks, is the nurse practitioner I saw. She goes, talk to me about hypermobility. Do you have any hypermobility or like joint differences? And I was like, oh, are you asking about this because of Ehlers-Danlos? And she was like, yes. She said, oftentimes Ehlers-Danlos and endometriosis go hand in hand. So if you're unfamiliar with Ehlers-Danlos syndrome or EDS, this is a connective tissue difference where basically your body produces collagen, but it produces a faulty version of it. So it's like you have the recipe for chocolate chip cookies, but when you make them, they come out like watery and they don't hold together. So my body, well, I'm assuming that my body makes collagen, but it makes like a faulty version of it. This would explain a lot of different issues I've had over the course of my life. And I was talking with her about it because in my mind, it was like, let me either pursue an endometriosis diagnosis or EDS. But with EDS, it's very hard to diagnose because there's not really any like definitive tests for it. I mean, there's like some hypermobility things that they can check. And there's a lot of different types of EDS. And then once you do have the diagnosis, like, what do you do with it? Probably just physical therapy. There's not like a whole lot you can do. So it was really relieving to me that she understood EDS and that these two things go hand in hand, that they were at least aware of that. They seem to have a very comprehensive knowledge of kind of the female experience with endometriosis. So I told her, I was like, okay, the injections sound great, but I just want somebody to go in and take it all out. So my appointment with the surgeon is tomorrow, and I also have the injections on the left side of my body, which I'm hoping will help my back muscle chill the F out because it hurts so bad. So I've got that tomorrow, and then hopefully we'll just schedule. Oh, he's doing something so cute. He's dreaming. What are you dreaming about? He was twitching. Oh, look at this little. Oh my goodness. Hi, buddy. So, anyways, I want to schedule the surgery and just. But this is the scary thing that I started this live stream with. You don't know if it's endometriosis until they open you up. But I mean, at this point, what else is left to do? I feel like there's no other stone that's unturned. Is that the right idiom? Other than for somebody just to stick a scope in me. So, yeah. But the more I think about it, I mean, I feel like I've been gaslit out of thinking it was endometriosis because that's what my mom and I both thought it was at the very beginning. And I was talked out of it by doctors. But it makes so much sense. Like, I would be the fourth generation of fourth generation of women. I'm a woman, fourth generation of woman. I don't know. Semantics. To have this issue, and then it just lines up with so many of my issues. So, anyway, so the Pelvic Rehabilitation Center is in my insurance network, but of course the surgeon isn't. So he works with the practice, but he's out of network. So, but at this point, I'm just like, I just got to feel better. But the hospital is in network. American insurance is so frustrating. America. Anyways. So things that have helped, it's hard to even say. On the questionnaire, it's like, for the doctor, it's like, what has helped? I don't know. Like, I feel like my pain is the same regardless of what I do. I just try to, like, go through my bag of tricks because it feels like maybe it helps, but I don't know. So, I don't know. I'm gonna have to go back and read through some of the comments because I was wanting to like hear from other women because I know many people in our community have gone through this, and I've talked to some of you, and I know it can be infuriating. And the average time it takes for a woman to be diagnosed with endometriosis is 7 to 10 years. 7 to 10 years. And this is like pain that affects me every day. And some women live with this I guess I can remember this pain as long as 6 or 7 years ago. It hasn't been this intense for 7 years, but so I just want to say to the women listening, like, I believe you. If you have this kind of pain, I believe you, and please believe yourself. And if you're in the DFW area or are within driving distance of DFW, it seems like the Pelvic Rehabilitation Center in Dallas is going to be a very good resource. I feel like they have taken me seriously so far, and you don't have to like prove yourself to the surgeon. It's like, as long as your stuff lines up on paper to people who really understand this and how complex it can be, it seems like they're going to be supportive of the decision to do a laparoscopy, which can be a really difficult thing to find. Endometriosis simulator? Oh, men need an endometriosis simulator. Yeah. Yeah, that's what, like, when I told my mom, I was like, my physical therapist said they found endometrial tissue in a man. And she was like, oh, they're going to start studying it more now. I was like, yeah, you're right, Mom. You're right. They're going to start studying it more now because men, it's found in men. So maybe, like, no, I'm not going to send it to more men. I wouldn't wish this on anybody. But yeah, I'll be interested to go back and kind of, oh my goodness, thank you so much, Rebecca. Thank you for your comment. You didn't know I go live. It's always funny to see myself talked about as she, like this being. I'm glad you're here, B. What do I collect? Cat snuggles. Oh, what are you doing? You sleeping? So busy. Yeah, so I will say, I guess I haven't talked about kind of the quality of it that might be helpful. The thing that I feel like is happening is that there's a lot of adhesions. It feels like the right side of my body, like my organs, are all stuck together. So whenever I do like a torso rotation, it feels like all my organs are like moving together. It's a really awful feeling. So I kind of have a feeling that there's some stuckness going on, which could also be related to the EDS, like connective tissue differences that could all be playing together with endo. So that's kind of what I think is happening, that the right side of my body has become glued together. Like, I guess, so my psychologist believes me more than anybody else. Like, they help me feel validated. And I was explaining this to them, and they were like, that's probably a really good indication of what is actually happening. Because I said, it feels like everything's glued together. And they were like, that's probably a good indication of what's actually going on. And I was like, oh yeah, I could be right about this. I could be absolutely right about everything that's going on in my body, and has been going on in my body for years. So we'll see. I mean, I'm also kind of terrified at the idea of taking time off from work and getting my childcare schedule like figured out so that I can have surgery and that I can, have support. It's like so daunting as a single mom. I know my mom's going to be there to take care of me. I'm like so grateful for her. Like I don't know what I would do without her. But it's so terrifying to think of like lining all of this up, having surgery, and then them not finding anything. But I just think at this point there's no way that they wouldn't. I don't like I've gaslit myself so much and I'm like, what if there's nothing there? I literally am on the couch because I can't work right now. Um so yeah, I'm gonna go back and read comments. Yeah. Oh, thank you, B. I appreciate that. Yeah, at this point I'm like, let them just look, and if nothing else, I do think that the injections are gonna help me manage the pain. And they said that this protocol of injections that they do, they recommend it even if you're going to go ahead and have surgery because it can lead to a more successful outcome because it can reduce the inflammation. It can make it easier for the surgeon to like find his way around. That's like this practice. I love them, but the surgeon is a male. I haven't met him yet, so I have nothing to say about him, but I really wish that he was a female. Just because I feel like with his intricate and just, it's like an intimate experience that's so female centered, and I'm so grateful for the surgeon that he's dedicated his life to figuring this out and studying it and dealing with complex issues. But I'm also scared of surgery, especially if there's EDS involved, because then connective tissues are more delicate and like my tissue is more delicate and recovery can be more difficult. But like the alternative is not getting surgery, which I think at this point I just can't deal with. So here's my thoughts for women with chronic pelvic pain. Trust your experience. Tune in with your body. Like, I do think our brain kind of overwrites pain sometimes, but make a point to check in with yourself and to believe the pain in your body, like not right over it. I have learned that occult hernias, like hidden hernias, are very common in women with pelvic health issues. So if it's not endometriosis, it could be a hidden hernia. And you really have to find, there are not very many people that will take occult hernias seriously in women or even know how to find them or operate on them. So if you've gone the endometriosis route and that hasn't worked for you, maybe another avenue to pursue would be occult hernias or Ehlers-Danlos. So if you find yourself just having dislocations or joint issues or just kind of diffuse body pain that you don't understand, Ehlers-Danlos could be a helpful thing to help you understand like more of your pain. So that's where I'm at. I can't definitively say that this is endometriosis, but I'm pretty sure it is. And I just really wanted to talk about it in case it's helpful because this has taken up so much space in my brain every day. And I feel like I've gone through so many avenues to figure out what's going on. So I hope it's helpful to someone. I'll keep talking about it, like after, especially maybe after I talk with my surgeon tomorrow and see how the left side injections go. And then, obviously, if and when I go through with a laparoscopy, I'll do my best to update and just kind of share what I learn along the way. Because I think, we're all in this together. And the more you know, the more you know. So, yeah. Okay, well, do you want to say bye, Mr. Beltray? So peaceful. Yeah. Well, thanks everybody for the well wishes, and I know I'm going to be okay. It's I think definitely made me stronger, and I do love learning about the human body. I think I could maybe take a break, if it meant being out of pain. I'd be fine with like not studying my body or different bodily processes for a while. I'd be fine with that. It's become kind of an involuntary special interest. Oh, that's interesting, Nessie Doe. There is an Ehlers-Danlos specialist in Dallas that seems, I have not met him. I'm totally making this up, but I think there's a very good chance he could be autistic because it sounds like he's made his whole life about Ehlers-Danlos, and he even to the point that he's almost like personality typed people with Ehlers-Danlos, and his whole practice is around like pain management for EDS, and um, he just sounds like a very interesting person who loves learning about EDS, and it's on my list to go see him because I would really love to teach more on it, and like that's part of why I got my autism diagnosis is because I wanted to teach on it and I wanted a professional diagnosis before I was just like, hey, YouTube, I'm autistic and this is what it means to be autistic. So I'm kind of feeling that way about EDS. I want to teach on it. I want to advocate and like raise awareness and understanding of what EDS is, but I want to have like a professional diagnosis first before I start, you know, getting on my soapbox about it. So I feel like I will probably give Dr. Cohen in Dallas a visit on the other side of all of this endometriosis stuff. That'll be another battle for another day. Well, thanks everybody for being kind and just sympathizing and for listening and watching. And if you want to share any of your stories in the comments, like women, let's go. Like, let's share our stories. I've also found a lot of really encouraging stories about endometriosis, pain, and like that whole journey on Reddit. I think there's a whole community for endo. So women, share your stories in the comments. Like, let's help each other find diagnosis and treatment and relief, and let's keep talking and sharing because that I think is the best way forward. So okay, well, if you need me, you know where to find me. Oh, his eyes are open now. All right, thanks for watching. I don't see the end button. I guess I'm stuck here forever. Yeah, crowdsourcing knowledge is, and that's why I wanted to go live. I'm like, let's talk about this. Let's push the needle forward. Oh, thank you, Ashley Jen. I do really need a hug. I receive it. Belcher, we got a hug. He's happy too. Okay, I think I just hit the X button. It's like you'd think I had gone live before on my phone and would know how to do this.